These tactics have not gone away, even though Blue Cross Blue Shield is sitting at the table and supposedly negotiating. In the background, they're preparing their attacks. Their attacks are they're painting a picture of a future system in which patients wait months for appointments and can't choose their own doctors. This was uncovered by the Washington Post. The irony of the situation is that Blue Cross Blue Shield of North Carolina has been fined $1 million for denying people medically appropriate care. So who is rationing care now? The truth of the matter is that the private plans ration care all the time. They deny care. They have to do that. How are they going to make a profit? You can't take care of sick people and make a profit. And in contrast, we do have a public system right now, Medicare. And every time Medicare has been compared, and people have been asked in surveys, the patient population, how they view Medicare versus private plans, Medicare has come out in terms of satisfaction, quality, and access. I've done my own studies comparing the VA system to some of the Medicare managed care plans and some of the private HMOs, and I found that, in general, the VA is better at delivering higher quality care. So again, the government is doing a better job. So even though we know the government is doing a better job, at least with the systems that we have, Medicare and the VA, why is it that there's this disconnect between perception and reality? I think one of the reasons is that only 3% of the population has an acute illness at any given time. And basically, most people don't realize how good or bad their health coverage is until they get sick. And unfortunately, this disconnect has led, I think, the opponents that we see the historical attacks on healthcare reform be so effective. So I think this is the proposal in front of us is a great one. We give people the option of keeping their private plan if that makes them feel better, but we give people a public plan option as well. What about physicians and reform? The physicians we're hearing right now are two sides of the spectrum. We hear the group, the single-payer group, that's saying government only, and we hear the AMA on the other side saying private only. But I think there's a silent majority out there that support a public plan option, and in fact, we're doing some work to actually survey physicians on this very issue. In addition, I think there are some physicians are beginning to speak out about their support for the public plan. One such organization is the organization I'm a member of, the National Physicians Alliance, and we're supporting the public plan option and actually circulating an active petition. So why do we need a public option? I think we need a public option because private insurers would still be free to deny care. There would be no accountability and transparency. And the alternative of just private plans with an individual mandate, I think, is very concerning because, again, no accountability. And the individual mandate might mean that low-income people would be fined if they couldn't afford to buy health insurance. In addition, I think competition from a public plan would keep private plans honest because the premiums for a public plan would be 30% less. And for the private plans to compete, they'd actually have to change their business model and try to garner satisfaction. And I think that that's what they're terrified of. So how do we get there? If we look at the history of Medicare, there were 3 ingredients. We had a strong and savvy leader, and we had the right representation in Congress. At the time, seniors got up and they went to Senate hearings and all the hearings that were held across the country, and they spoke about how they needed Medicare, health care, because in their old age they were getting bankrupt. And there was a movement. The seniors had a movement. So we have a strong and savvy leader, and we have the right representation in Congress, but we need to make Congress give us the option of a public plan. So first they ignore you, then they laugh at you, then they fight you, then you win. It's about 100 years now. It's about time we won. Thank you for your attention.
Thank you, Salomeh. Again, the Congress should listen to the doctors.